In trauma situations, there isn't always time to pause for consecutive interpreting. In those moments, interpreters may need to interpret simultaneously to preserve the flow of care. I couldn't find a clear example of how this works in healthcare, so I created one.
His blood pressure is 78/42 with a heart rate of 132. He's pale and diaphoretic.
Su presión está en 78/42 con el
He's
ritmo cardíaco en
hypertensive. We have
132. Está
significant blood
pálido
loss.
y
Applied
diaforético.
direct pressure above the injury.
Está
Where's the
hipotenso con
tourniquet?
hemorragia abundante. Apliquen presión directa sobre la
Tourniquet is
herida.
secured to the right
¿Dónde
thigh.
está el torniquete? El
Good.
torniquete está
Activate the
sujeto
massive
sobre el muslo
transfusion
derecho.
protocol. Send type and cross. Start
Y
O negative
activen el
blood now.
protocolo de transfusión masiva. Hagan grupo y prueba cruzada.
Sir,
Administren
you
sangre
were
O
in a car
negativa
accident.
ahora.
Your right leg has been severely injured. You're
Señor,
bleeding
tuvo un
heavily,
choque
but we are
automovilístico.
working quickly
Tiene
to
una lesión
stabilize you.
grave en la pierna derecha. Está sangrando mucho, pero estamos
Get large
trabajando
bore IV
rápidamente
access.
para
Two
estabilizarlo.
14-gauge lines. Prepare for possible
Pongan
intubation.
accesos de gran calibre. 2 vías de 14G. Prepárense para posible intubación.
Oxygen saturation is dropping. It's at 88%.
La saturación de oxígeno le está bajando.
Me siento
está en
mareado, siento que me voy a
88%.
desmayar.
I feel
Stay with
dizzy.
us.
I feel like
We're
I'm
giving
going
you
to pass
blood
out.
and IV fluids. Try to keep your
No
eyes
se
open.
nos vaya. Le estamos poniendo sangre y suero. Abra los ojos.
If he doesn't respond to fluids, prepare vasopressors. Let's move.
Si no
We
responde
need
a
to get
los
him to the
líquidos,
operating room.
preparen los vasopresores. Vámonos. Tenemos que llevarla al quirófano. Before we wrap up, let's talk about what occurred in this simultaneous interpreting session. First of all, the goal is not to interpret word for word, but to ensure the patient has access to all the information in real time. For example, when the trauma surgeon said, "Try to keep your eyes open," I interpreted as "abra los ojos." Literal translation, "open your eyes." The meaning stayed the same, but the delivery was more direct so that it could land quickly. Another example is how I described bleeding. Early on, I used more technical Spanish. Later, when the surgeon spoke directly to the patient, I preserved the meaning but chose different terms for better understanding. The information stayed consistent, but the register changed because the audience changed. This is why simultaneous interpreting is such a difficult skill to master. You're focusing on meaning, pace, and multiple speakers at once, while protecting the patient's access, allowing them the chance to participate. If you're interested in developing these skills further, I teach a class focused specifically on simultaneous interpreting in healthcare settings. I'll leave the details below.